All right, let's get right into it. We're going to pull back the curtain on some of the most powerful tools in all of medicine, the emergency drugs that can literally be the difference between life and death. You know those scenes in medical traumas, right? The crash cart comes flying down the hall in a moment of pure crisis. But have you ever stopped to think what's actually in there? It's not just a random collection of supplies. No way. It's a precision-engineered arsenal of life-saving medicines.
And just take a look at this list. I mean, wow, that can look a little intimidating. But every single one of those names is like a unique key, designed to fit a very specific lock inside the human body when things have gone catastrophically wrong. So let's break it down and figure out what these drugs really do.
First up, let's talk about the heavy hitters. I want you to think of the heart as the body's engine. Well, these are the drugs you call on when that engine is sputtering, stalling out, or has lost power completely.
So, what's one of the first things to go terribly wrong in a crisis? It's pressure. The whole system just loses pressure. We call this shock or hypotension, and when that happens, blood and oxygen aren't getting to where they need to go, and that is a massive, life-threatening emergency.
When the body is in crisis, you need a powerful response, and you need it fast. And there is nothing more iconic than adrenaline. It's the ultimate jumpstart. When the heart is stopped, it gets things going again by cranking up the heart rate and the blood pressure. It's basically the body's own Control-Alt-Delete. Now, a close cousin to adrenaline is noradrenaline. And if adrenaline is the all-purpose emergency button, noradrenaline is the specialist. Its main job is to be a powerful vasoconstrictor, which is a fancy way of saying it squeezes the blood vessels to dramatically raise that dangerously low blood pressure during shock. And then we have dopamine, another absolutely crucial tool in that fight against shock. What's really special about dopamine is that it does two vital jobs at once. It increases the heart's pumping power, but it also improves blood flow to the kidneys, which is so important to protect during a major crisis.
So let's do a quick recap. Adrenaline is the big red restart button for the whole system. Noradrenaline is the pressure specialist, and dopamine boosts the pump while protecting the kidneys. Three related drugs, but each with a very distinct critical role to play.
Okay, so we've talked about a heart that's losing power, but that's not always the problem. Sometimes the issue is electrical. The timing is all wrong. The rhythm gets dangerously fast or super slow or just total chaos. So let's look at the drugs that fix the body's wiring.
And this is where it gets really cool. Check this out. We've got two drugs here for two completely opposite problems. On one side, you have atropine. It's for when the heart is beating way too slowly. That's called bradycardia. It basically tells the body to take its foot off the brake. And then on the other side, you have adenosine, which does the exact opposite. It's for a dangerously fast rhythm, and it works by briefly hitting a reset button on the heart's electrical circuit, giving it a chance to restart at a normal, healthy pace.
So what happens when the rhythm isn't just fast or flow, but pure electrical chaos? That's ventricular fibrillation, where the heart muscle is just quivering, not pumping at all. To calm that electrical storm, you bring out amiodarone. This is a powerful drug that stabilizes the heart cells, calming everything down so the heart can regroup and start beating effectively again.
Okay, let's switch gears a little bit, because sometimes the emergency isn't a problem with the heart, but with the body's own immune system going completely haywire. We're talking about an allergic storm, and you need drugs that can calm it down and calm it down now.
You know when you have an allergic reaction, all the itching, the hives, the swelling, that's all caused by a chemical called histamine. So the first line of defense is, you guessed it, an antihistamine, like chlorpheniramine. It gets in there and it just blocks that histamine from causing all that trouble.
But when it's a truly severe reaction, we're talking a major asthma attack or the body-wide inflammation of septic shock, an antihistamine just isn't going to cut it. You need something much, much stronger. That's where corticosteroids like hydrocortisone and dexamethasone come in. These are like the body's fire department. They don't just block one chemical, they suppress the entire immune response to get a dangerous, out-of-control fire under control.
All right, for our last category of drugs, we're not talking about restarting engines or calming storms. We're going even deeper, to something more subtle, but just as critical, restoring the body's fundamental chemical balance. Now here's a wild thought. Your body has to maintain its pH in a super narrow range, kind of like a swimming pool. When someone is critically ill, their blood can become dangerously acidic. That condition can cause organs to fail. So what do? You use sodium bicarbonate. It's essentially an alkalinizer that corrects the body's pH, bringing it back from that acidic danger zone. Another huge crisis is fluid overload. Just imagine the lungs filling up with fluid. That's called pulmonary edema, and it's basically like drowning from the inside out. For that, you use a powerful diuretic called furosemide. Its job is to kick the kidneys into overdrive, telling them to pull all that excess fluid out of the body, fast, so the patient can breathe again.
And finally, in the midst of all this chaos, there's a person who is probably terrified. And that's why a sedative like midazolam is so incredibly important. It helps reduce anxiety and calm the patient during scary procedures, like being intubated. It's about treating the body's chemistry for sure, but also the human being at the center of it all.
So, we've gone through this whole incredible toolkit, but here's the thing. The tools are only as good as the person using them, and that, right there, is the real heart of the story.
This quote just hits the nail on the head, doesn't it? The margin for error with these drugs is razor thin. What can save a life 1 second can be incredibly dangerous the next. It just shows you the immense pressure and precision that's required.
And what's really interesting is that if you look at the clinical information for any of these drugs, you'll see a recurring section, Nurse's Responsibility. And it's not just a short little note. It is a constant, vigilant process of monitoring vitals, checking blood work, calculating the perfect dose, watching the patient's response second by second, and being ready to adjust on the fly. It is an unbelievable display of skill and focus under extreme pressure.
So, as we wrap this up, it's pretty clear these drugs are miracles of modern science. But the real miracle, that happens at the bedside. It's the trained professional, interpreting the data, making the tough call, and turning a simple vial of liquid into a second chance at life. The drug is the tool, but the expertise is what truly makes all the difference.